invasive ductal carcinoma on my left breast. I don't know that I would have felt this supported outside of the VA health system.
Women are the fastest growing demographic in the military, and that's going to be true in the VA. As those women who have served in the military in their 20s and 30s age into 40s, 50s, 60s, 70s, we need to be prepared for these women when they are diagnosed with cancer, because that happens as humans age. So the VA has specifically made a focus on trying to increase capability and systems around taking care of women with cancer. So we, the Breast and Gyne System of Excellence, are one of those efforts. We've created a virtual tumor board that meets every 2 weeks to talk about veterans with breast and gyne cancers, where experts from around the country can get together virtually and review their case, their pathology, their radiology, and talk about the best treatments for them geographically where they are. We also have virtual clinics, and there's also some clinics being built for women who don't have cancer but are at high risk for cancer because of genetic mutations.
Even if you don't have a cancer diagnosis, we've created this high-risk clinic because we know that there are veterans out there who are at increased risk, and we could do things to prevent you from getting cancer in the first place. I found out that I actually had a BRCA1 mutation that increased my risk of breast and ovarian cancer. I've had my ovaries removed, and so I think that helps a lot for patients when they know that, their provider, has their own personal story.
Cancer takes control away from everybody. It doesn't care if you just planned a vacation. It doesn't care if there's a pandemic happening. It doesn't care if, you just started a new job and you don't have any time off, which is what happened to me. It makes it easy to relate to my patients, since I've been through most of what they've been through too.
Being in healthcare and knowing all the things that cancer can involve, your mind jumps to the worst. My oncologist, Dr. Alder, wrote out an algorithm for me of, if these tests come back as this is what we do. So it was like a 4-step process. So having that when they called me and told me what my results were, I could just go down to the algorithm and go, okay, so this is the plan we're on. Everybody has been wonderful, from primary care to radiology. They're like an extension of my family. And I run into those people in the hallways now that I'm back at work and always asking, are you okay? Are you sure you were ready to come back? It definitely has made me a better provider. I don't flippantly say things like, oh, you're just gonna go home with a drain. I now have a better understanding of the burden of having surgery and going home with certain unknowns. Best decision I made was to stay here within the VA system.